Hello everyone, welcome to Dental Mate. Today in this video we'll be discussing about the radiographic examination of COVID-19 disease. So let's get started. So if we talk about the radiographic examination, first is the chest X-ray. Now a disadvantage we can say with the chest X-ray is that in early stages it does not show any signs or symptoms. Next is ultrasound or POCUS, that is point of care ultrasound. After that is HRCT scan. So if we talk about chest X-ray, this is not preferred because no findings are seen in early stages. That is, up till 10 to 12 days of COVID-19 infection, there are no findings seen in the chest X-ray. So this is the chest X-ray. The most common finding which is seen is ground glass opacity. What we can see here marked with arrows is a bilateral patchy and confluent band-like ground glass and consolidative opacity in peripheral mid to lower lung zone. Okay, so this is basically a diffuse hazy opacity which is seen. This is known as the ground glass opacity. Next is the point of care ultrasound or POCUS. See, this is better than chest X-ray because there is early detection of subpleural consolidation with POCUS. Okay, so this is an early stage of the point of care ultrasound. In early stages, what we can see is the horizontal line is the pleural line which is thickened. Okay, so there is thickened pleural line. Along with that, we can see certain B lines which are transient hyperechoic vertical line extending from the pleura to the bottom of the screen. Okay, so see, these are ubiquitous single B line extending from the pleura to the bottom of the screen. Okay. Now, two single ubiquitous B lines and diffuse broad B line also is seen. See, these are the broad B lines which are also seen. Now, the broadened B lines, they actually indicate the worsening of the damage. Okay. Also, how to infer this? If there are more than 3 B lines per ultrasound window, then this indicates certain abnormalities or pathologies referred to as wet lung. Okay, more than 3. How many can we see? Single, two single, and two fused B lines. So these are more than 3 B lines per ultrasound window. This indicates pathology or abnormality referred to as commonly wet lung. Next, if we talk about advanced stage, then there is thickened and fragmented pleural line. Okay. There are diffuse confluent B lines. Now, also what is seen in CT scan is a patchy diffuse ground glass opacity with thickened interlobular septas. See, thickened interlobular septas and also intralobular lines. Okay. See, this gives an appearance of disorganized paving stone. So, this type of appearance is named as or known as the crazy paving pattern. What we need to remember is in CT scan, a crazy paving pattern is seen in patients with COVID-19 disease. Now, base so next is a city scoring system. Basically, based on the extent of the lobar involvement, this city scoring system is devised. So there are total 5 lobes, and each of these lobes are numbered from 1 to 5. How do we number from 1 to 5? If there is less than 5% damage of the lobe, there is 1. It is numbered as 1. 5 to 25, then 2. 26 to 49, then 3. 50 to 75, then 4. And more than 75%, then 5. Now, this basically tells us about the COVID-19 disease severity. Okay? If the score is less than or equal to 7, then the severity is mild. If the score is between 8 to 17, it is considered as moderate. If the score is more than or equal to 18, it is considered as a severe COVID-19 disease. Let us consider the lobe number 1 has been assigned a number or a score of 1, lobe 2 of a score of 2, lobe 3 a score of 3, lobe 4 a score of 1 again, and lobe 5 a score of 3. If we total all of these, it would be 10. So because the number or the score is 10, then we can infer that the patient is affected with moderate COVID-19 disease or moderately severe COVID-19 disease. So this is it about the radiographic examination of COVID-19 disease. Do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss the latest updates. Stay tuned, keep visiting. Thank you.